I can go back to my normal life. Actually, I can do exercise more. So I'm really thankful for the entire team of Canadian Hospital. Hi, I'm Elpidio Bernardo. I'm from the Philippines. I'm 42 years old. Last few months ago, I tried to do some exercise. After that, I noticed some difficulty in breathing and I got easily tired. So after I saw our GP doctor, so he advised me to consult a cardiologist. So luckily, I received a message, like a marketing ad from Canadian Hospital that Dr. Amal just recently joined the company, and he's a cardiologist and a interventionist. So for checking, so I went to the website and I looked at the profile of Dr. Amal. So I was really impressed about his track record, that he has done so many procedures regarding cardiology intervention. So I am confident. So from that day, from that time, I decided to consult Dr. Amala and book an appointment with him.
Hi, this is Dr. Amal A Louis, Consultant Interventional Cardiologist at the Canadian Specialist Hospital. Mr. Elpidio is a young male who has been having shortness of breath over the past few months. He went to his GP, who examined him and identified a heart murmur. Immediately he was referred to our cardiology department, where I saw him, I assessed him, and I could confirm that he had a heart murmur, and I suggested that he had an echocardiogram, which is like a 2D ultrasound scan of the heart. He underwent the scan, and the scan, to our surprise, showed a very severe narrowing in one of the heart valves called the mitral valve. This type of narrowing is quite uncommon in this part of the world and in the Western world. However, we do see these, what we call as this rheumatic valvular heart disease, in South Asian expats who are in this country. This condition is something that's acquired during childhood when they have a streptococcal throat infection, and this infection then affects multiple joints, and in some people it damages the heart valves and presents later on in the life, like in Mr. Elpidio's case, with a sticky valve causing severe narrowing in the opening of the heart valve, or sometimes even leakage of the heart valve. So echocardiogram showed that the valve was quite severely narrowed, but fortunately his heart function was preserved, therefore giving us the option of repairing the valve and making the heart function normal. And to assess the valve further, I recommended a procedure called a transesophageal echocardiogram. It is a slightly superior scan to a standard echocardiogram, which is done from the front of the chest, where we ask the patient to swallow a tube with this ultrasound probe that goes into the stomach and look at the heart from inside the stomach, where you get a better, clear picture of the heart valves. And once again, this procedure confirmed that the valve was severely narrowed, and with this procedure we could identify that this problem can actually be fixed with a balloon procedure rather than an open heart surgery with a mitral valve replacement. We immediately planned for this procedure at the Canadian Specialist Hospital, which is done in the cath lab, and he had a successful balloon mitral valvuloplasty, where a balloon is inserted more often through the veins in the groin to the right side of the heart, and then using a small needle we puncture the partition between the right and left side of the heart and enter the left side of the heart, and then insert the balloon into this mitral valve, which is a valve on the left side of the heart, and dilate it successfully. This valve area, which was very small, but almost doubled after the procedure, allowing much more free flow of blood within the heart chamber. The outcome was evident pretty much immediately on the pressure tracing that we obtained during the procedure and before and after the mitral valve procedure. The procedure was uncomplicated. It was observed in the CCU for 24 hours. The tube in the groin was removed and just compression was applied just for 5 minutes to stop the bleeding, and he started walking within 4 hours, and the next day he was discharged from the hospital. So this procedure, which has been done for the very first time at the Canadian Specialist Hospital, is an alternative to an open heart valve replacement, especially in young people like Mr. Elpidio, who's now able to get back to his work without any difficulty, and he's come back for a follow-up, and I was very pleased to note that his symptoms are much better and he's able to do much more exercise and perform at work even better.
I'm really thankful to Dr. Amal and the Canadian team, the cath lab, for the success of the procedure. They really did take care of me from day one until the end of the procedure. There is a big difference now in what I feel right now. I would say 90% or 99% is okay now. So I can go back to my normal life. Actually, I can do exercise more. So I'm really thankful for the entire team of Canadian Hospital. And I would advise people to, if you feel any symptoms, don't be, don't just disregard it. Consult a doctor, because, as they say, health is wealth. Thank you.
Keeping you well. Canadian Specialist Hospital, Abu Haya, Deira, Dubai. For appointments, call 04-707-2222. Visit www.csh.ae.